Hello, I'm Dr. Radhika. So before we talk about glutathione, let's try to know what is this hype about? Why is everyone trying to have the skin whitening? And how does a person be of the skin color that he is? So all of us have something called as melanin, which is of two types. One is a pheomelanin, one is a eumelanin. Eumelanin is the one which has a darker pigment, whereas pheomelanin is the one which has a lighter pigment, that is the reddish yellow pigment, whereas the eumelanin has the brownish black pigment. So a person who has a lot of pheomelanin, that is the reddish yellow pigmentation, then he is more towards the fairer complexion, whereas a person who has a lot of eumelanin, that is the brownish black pigmentation, he is more towards the darker complexion. So what are the medications that is used for skin whitening? So there are so many over the counter medications that is out there in the market, which is used in the topical form or a oral form or even the intravenous forms. The topical forms can be in the form of kojic acid, glycolic acid, vitamin C, vitamin E, and so many other things. And it can also be in the form of oral medications like tranexamic acid, your vitamin C at a higher dosages, or glutathione. And these days it is also the glutathione intravenous injections which is the hype. So out of all this, why glutathione has a hype? Because glutathione has a faster onset of action compared to all of these things. So let's try to know what is this glutathione. So glutathione is always produced in our body. That is, it is nothing but a small molecular weight thiol tripeptide which is made up of glutamate, glycine and cysteine. So it is usually present intracellular. That is, it is present inside our cells in a reduced state which has multiple functions, and in one of the function is what it converts the eumelanin to pheomelanin, that is from brownish black pigment to multiple reddish yellow pigment has been formed, and that's how it causes skin whitening. And it is also a multipotent antioxidant. It reduces all your free radical oxygen species, and that's how it is an antioxidant. So is glutathione available naturally? Yes. It is also seen in spinaches, green leafy vegetables, walnuts, avocados, tomatoes, and whey proteins also. What are the formulations of glutathione? It can be in the form of a topical cream, it can be in the form of a topical serum, or it can be in the form of oral tablets. Sometimes it can also be given as a sublingual route where you keep it under your tongue and it gets absorbed into your system, or these days it's the intravenous glutathione which is the hype. So out of all this, it is known that if a person takes glutathione intravenously, then the serum level of glutathione is higher. That means when you take it as in the oral form or a sublingual form, the concentration that reaches your blood is very less. So what is the dosage a person has to take? So the dosage is 1 to 2 grams per day in a divided dosage. That is, if you are taking 1 gram, you have to take 500 mg 2 times a day. If you are going up to 2 grams, it is 1 gram twice a day. So if a person is getting or want to get a IV glutathione, then it is usually 600 to 1200 mg. That is 0.6 grams to 1.2 grams of injection glutathione is given weekly twice for a period of 2 to 3 months. So a person can ask how fast or what are the results that we expect after using glutathione. So if a person has used a IV glutathione, then we can expect the results up to like 3 to 6 months. And what are the results that is to be expected? It is a clearer glowing skin rather than a skin whitening that can happen in the first 2 to 3 months, and slowly a continuous usage of glutathione in the form of oral and intravenous, a person can expect skin whitening. And it all depends on each and every individual's amount of the antioxidant and amount of the oxidative stress levels that is there, and also amount of the eumelanin content in his skin. Can anyone take glutathione? No. It has to be not taken in person who has a liver disorder, kidney disorder, or a person who has any kind of a drug allergy or a previous history of SJS or TN. So, is it worth the hype? That means there is also adverse effect that we see due to glutathione. It can be a liver dysfunction, a kidney dysfunction, or a thyroid dysfunction. That's why all of your dermatologists or your doctors get a liver test or a kidney test or your thyroid test in between or when you are on the glutathione treatment.